Okay. Hi, everybody. I'm so happy to see you. I'm Dr. Howard Elkin, the medical advocate, and I'm thrilled and really pleased to see you guys here. This is the first of what I hope to be many series. Welcome to my new live, a YouTube live series. It'll be held every other Thursday at 7 o'clock p.m. Pacific time. And each session will begin with me with a brief discussion about 10 minutes, and then followed by you coming in as the audience asking questions. The whole program should last about 30 minutes. Now, before we start, I just want to kind of mention this whole thing about medical advocate. Like, how did I get that name and what does it mean? Well, some of you might not know this, but a few years ago, I was hospitalized not once, but twice in a span of 19 months. And what I learned as an inpatient is that I really had to step up to the plate when it came to my health. I mean, I thought I was in prime shape and I was doing everything right. And I was to a certain extent, but there were a lot of things I had to learn to really pull in the reins as it related to my health. And so I branded myself as a medical advocate. That was a few years ago. Now what I'm hoping, my quest now is for all of you to become your own medical advocates. And you don't need to even have a medical degree. It's just being in touch with your body and knowing what to do. So with that in mind, let's start off. Today's topic is, defining functional medicine. What is functional medicine? I mean, is it the opposite of like dysfunctional medicine? I don't even know what that term is supposed to mean, but I want to give you a couple of definitions. My definition of functional medicine is we're looking at the root of the problem, what caused the problem, as opposed to just putting a Band-Aid on it and trying to fix it. And that's what we do in functional medicine. But I want to give you a couple other definitions that I think are appropriate. Now, one is from Wikipedia. You're all familiar with Wikipedia, which is a free online encyclopedia. Now, this is what they said about 8 years ago when I looked up functional medicine. And then when I went back 2 years ago, I was preparing for a conference, a presentation. The same definition was there. Then I checked back 2 days ago, and the same definition is there. And this is it. Functional medicine is a form of alternative medicine that encompasses a number of unproven and disproven methods and treatments. Wikipedia. That sounds like medical quackery, doesn't it? And that was just a few days ago, which is pretty amazing. Now, functional medicine, the term itself became kind of more of a commentary, became known in the early part of the century. And Dr. Geoffrey Bland was the founder. And this is how his Institute of Functional Medicine defines it. Functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. And I pretty much adhere to that same philosophy today. Now, let's go over a few distinguishing points with traditional medicine versus functional medicine. Now, traditional medicine is often, it's pretty much disease-oriented, heart disease, cancer, autoimmune disorders, Alzheimer's, and other forms of dementia. Whereas in functional medicine, we're looking at overall health. Now, a few years ago, I came up with what's called the 4 quadrants of wellness: physical well-being, mental well-being, which is memory, emotional well-being, and then spiritual well-being. And then my oldest daughter, about 2 years later, said, "Dad, you forgot something." So what's that? She said, "You forgot social well-being, because we live with other people, right? We don't live in a bubble." And I thought about it, and she was right. But it just screwed up. I couldn't use the word quadrant anymore, so I had to choose something else. So I chose the 5 dimensions. But in functional medicine, we don't think about that. We don't think about overall wellness. We're looking at a disease or a symptom and going from there. Another distinguishing point that you need to know is that in traditional medicine, we're really much doctor-centered. I'm the doctor. I know what test to order. You get the test. You come back to me. I know what treatment is best for you. That's kind of like the traditional way, the traditional world model. In functional medicine, it's patient-oriented, patient-driven. I listen, you give me your history. And I often tell my patients, I'm your second opinion. They say, "Well, who's my first?" I say, "You are," because nobody would know your body better than you. So it's about patient empowerment. And that's the difference between what we see in traditional medicine versus functional. Then I love this one size fits all. They still like to do that. It's kind of the cookie cutter approach or Band-Aid approach to treating medicine. And let me give you a simple example. This has happened multiple times, but about 4 or 5 years ago, I was discharging a patient in the hospital who was there for a heart attack or congestive heart failure. So I gave the patient prescriptions. I'm talking to the patient. I'm about to leave, and the nurse manager, the discharge place, Dr. Elkin, you forgot something. Like, what? You forgot to order a beta blocker or ACE inhibitor on Mrs. So-and-so. I said, no, I didn't. I didn't think it was warranted. They said, well, your chart's going to fall out of compliance. It's like, really? I have to worry about my chart falling out of compliance when I really don't think that patient needs that particular medication. That's the difference. What we see in traditional medicine versus functional medicine. It's not a good cutter approach. It's not one size fits all. It's what's best for the individual patient. And the other one is waiting for symptoms. In traditional medicine, we usually wait for symptoms, chest pain. We get certain tests done. We're not really proactive with health. Whereas in functional medicine, let's look at like a cardiology patient, for example. If I know they have high risk factors for heart disease, I'm probably going to do a stress test on them. I might do I might do an echocardiogram. I'm not waiting for symptoms. I'm doing advanced laboratory testing that we often don't do in traditional medicine because I want to know everything about the patient. I want to know, what is their gut function like? What is their neurotransmitters like? Their adrenal function? These are things we don't think about in traditional medicine, but they are important because it really makes the patient overall well. We're not just talking about disease. So I want to end this one segment with giving you a couple of case examples that are real. So one was a 46-year-old female who is relatively healthy, and she was having severe anxiety. She couldn't, and severe insomnia and palpitations. Heart was palpitating all day and all night, kept her up at night. She then developed anxiety and phobias. She was afraid to drive on the freeway, which is pretty bad if you have to drive from Whittier to downtown LA every day. So she went to the first doctor, and he was a cardiologist, and he said he did stress echo on her and a Holter monitor. And said, everything's fine. That's the good news. But the bad news is that you have to live with this. It's nothing bad. You have to live with it. And I said, live with pain? Who in the hell wants to live with pain? So she didn't like that. So she went to another doctor who put her on antidepressants, hypnotics to make her sleep at night, and also antidepressant. And within like a month or so, she was a zombie. She gained weight. She could barely function. So finally she came to me, and I found out quickly that she had a normal menstrual cycle, but she was 46 years old. So I'm thinking progesterone, low progesterone. And I drew her hormone levels, which had never been done before, on days 21 to 23 of her menstrual cycle. And lo and behold, her progesterone level was in the toilet. She had no progesterone. Progesterone is a calming hormone. It helps with sleep. It helps to quell migraines and palpitations. I put her on natural progesterone on days 13 to 26 of her menstrual cycle. She's like a different person. She thought I was like some kind of god, and I wasn't. I just listened to her story and was able to go from there. Another brief example was a gentleman who came to see me recently, actually, about 38-year-old male, slightly overweight. He had high cholesterol, maybe 256, 258, and an LDL, which is a lousy one, right, of about 145, 148. And the first doctor said, you need to be on a statin. He said, I'm not going to go on a statin. I'm too young. I don't think I need to go on a statin. He said, I'm going to try diet. He said, okay, I'll give you 2 months to try diet. The doctor put him on a low cholesterol, low fat diet. And guess what? Nothing changed. Then he came back and he said, I'm ready to put you on a statin. He said, no. So he came to me and I said, okay, let's first assess your risk. I don't care what your LDL is. I do care if you are high risk. And I did some appropriate testing that we don't normally do in traditional medicine. And I felt that he was pretty low risk. So I said, why don't you work on lifestyle? I gave him a few exercise tips, and I put him on a low carb diet. I said, I don't care about your red meat. I don't care what you eat, but I want to put you on a low carb diet. In 2 months, he lost 15 pounds, felt significantly better, and his lipids were improved. So this is what we're talking about when we compare traditional medicine to what we call functional medicine. And I want to end on one thing, and that is we need both. It's not just functional medicine or for traditional. I mean, if I'm on call as your cardiologist and you come into the hospital with an acute heart attack, you better believe I'm going to rush you to the cath lab and do everything in my power to open that artery. If you come to the hospital and you have an acute abdomen, acute appendicitis, you better pray that there's a surgeon in there that can bring you to the operating room and get that out. So there are times you really need traditional medicine when it rains. But so many of the problems that we see in medicine today are of a chronic nature. So you have time to think things out, get opinions, and that's where functional medicine has its place. So with that in mind, I'm now open for questions. So please, anybody with questions, I'd love to hear it. Okay. Okay, question by Berkeley. Are you allowed by insurance and the hospital to do whatever kind of tests you want to do? Okay, it's the right question. Yes and no. First of all, in the hospital, my goal is to get patients in and out of the hospital as quickly as possible. So most of the work that I do is as an outpatient. Many of the tests that we do in functional medicine are covered by insurance, but a lot of them aren't. So, which is not a good thing. So you have to pick and choose. I mean, I could order any number of battery of tests, but I pick and choose. But a lot of them are covered by at least a certain portion by insurance, Medicare included. The ones that fail are the HMOs. I would say HMOs do not cover any of the functional medicine tests. So that does make it difficult. And because I'm in my own practice and I don't practice within a group, I can pretty much order what I want to do. So thank goodness I have that ability to do that. Okay, let's see. Monica gave a comment. Why wait for the patient to have a heart attack or chest pain to screen? Absolutely. And again, what I do is I assess a patient's risk. I don't care what the cholesterol is. I mean, I do, but I don't. But I do care if they're at high risk, and that's what I look for. Okay, Trevor has a question. Because statins are so commonly prescribed, often overprescribed, when do you think it's appropriate, if ever? What is your philosophy on lifestyle medicine and supplements versus cardiovascular drugs? Whoa, that's a big one. Okay, first of all, I'm not a statin basher. I do believe that there's a role for statins, and that's generally what we call secondary prevention, meaning people that have known heart disease, that have had a heart attack, a stroke, or bypass surgery or a stent. They may well be, they may need to be on statins. That's called secondary prevention because we're trying to prevent a second or third heart attack or stroke. But so many of the people out there are put on statins, especially middle-aged women. Can you believe it? Because women tend to be more compliant with medications. Doctors feel very comfortable prescribing them statins. Totally unnecessary in most cases. I always go for lifestyle first. And again, I'm very careful about taking up important diet history and exercise history. I find out what's going on stress-wise in a patient's life. So I take the time to get those questions answered. And then I always, like most people in functional medicine, we always try to shoot for lifestyle first. And I do use supplements. There are supplements that we can use for high cholesterol, like red yeast rice supplement. There's also there's the battery of fish oil, coenzyme Q10. There's a list of supplements, olive leaf extract. So I've used a lot of those. So there's a lot we can do with that. Now, okay, the shrink shop. How does a doctor become a functional doctor? Apart from you, of course, how would someone locate one? That's a good question. There's two major sources. One is the American Academy of Anti-Aging Medicine, which is how I got interested in longevity medicine and functional medicine. So they do have a website. It's 𝗃𝗀𝗻.org. It's American Academy of Anti-Aging Medicine. So 𝗃𝗀𝗻.org, and they should have a list of doctors that they recommend. Also, the Institute of Functional Medicine, IFM. They also have a list of doctors that should practice functional medicine. As far as the credentials are concerned, I became board certified in anti-aging medicine, so I had to complete certain modules and do both oral and written boards. So I definitely went through a certification process. I believe the same takes place for the IFM. But I think if you go on the website, you can probably find them. It's for sure. I mean, I think it's becoming more commonplace, but still it's relatively new. When you read what you saw and what I just read in Wikipedia 2 days ago, still a lot of people really don't believe, they don't understand or embrace it. They may understand, they don't really embrace it. So That's where I like to make a difference. Okay, Monica, aside from exercise and exercise, what herbs or tinctures would you recommend in combination for lowering cholesterol and triglycerides? Okay, I use a lot of niacin because I'll tell you why. Niacin is actually a vitamin. It's vitamin B3, but we use it in larger doses, so it becomes kind of like a drug when we go to 500 milligrams or more, and that's very good for lowering triglycerides and also for changing the LDL particle from a small to a large. And we're going to get into that in a future session. But one of the things I'm interested in assessing the risk is the size of the LDL particle. All you got to remember is one thing for me: bigger is better. Whether it's HDL, LDL, the bigger the particle, the less likely you are to form plaque in your arteries. So niacin is very useful in doing that. There's also there are other supplements that can be helpful, but that's the best for triglycerides. Fish oil is very good for lowering triglycerides. You generally need to have larger doses than like 1 or 2 grams. You might need up to 4 to 6 grams, but that I've been very successful in lowering triglycerides with fish oil. So I hope that answers that question. Okay. Let's see. Okay. Priority 1 projects. I've never heard of functional medicine until I started working with a chiropractor a few months ago. He is taking many of the same approaches you have. You know, God bless the chiropractors of the world because they had to learn how to market themselves years ago. As doctors, we were able to get paid by insurance. So chiropractors really deserve a lot of credit because they really had to go out on a limb and figure out, how do I earn a living? So they really the ones that embraced functional medicine way before doctors did. I mean, I'm still one of the few integrative functional cardiologists that I know of. And try to find a functional gastroenterologist or a functional endocrinologist. It ain't easy. And so it's difficult, you know, but I'm hoping that more as we evolve over time, we'll get more of them. Okay, he told me that MDs don't practice functional medicine. I guess you're exceptional. Do you know of many MDs practicing functional medicine? Uh, no, not true. I mean, I'm learning more and more. I'm involved with a group, and I mingle, and I try to get to learn other functional medicine practitioners. I have learned there are some very good ones, mostly on the west side. I'm in Whittier, so it's very old-fashioned community, and I'm learning. There's a couple of really good people I've met in Orange County area that I'm impressed with. So it's coming along. It's going to be it's an evolutionary process. Okay, Nicholas, how important is gut health in functional medicine? Wow. Okay. Now, gut health is everything. If we don't think of the gut as the second brain, and my saying is you're only as healthy as your gut. So if your gut's not healthy, you're not healthy. And I remember when I was doing my A4M fellowship, and there's a whole day of GI, and I'm saying to myself, I don't really like that. I don't really like this. I'll just refer it out. And then I thought to myself, well, who am I going to refer it out to? Because all the gastroenterologists that I know, they're very good at scoping above and below. And what they're looking for is structural gut disease. But these can look normal from a structural standpoint. And yet, functionally, there's some major problems. Inflammatory irritable bowel syndrome. Irritable bowel is a big one. Leaky gut. SIBO, which is small intestinal bacterial overgrowth. So these are really important because why? Why do we call it the second brain? Because we now learn that there's a gut-heart connection. There's a gut-brain connection. And here's how I look at it. You and I, all of us, we're composed of 10 trillion cells, okay? But in our gut, there's 100 trillion bacteria. They outnumber us 10 to 1. So you better believe there's a synergistic existence here. We need them, and they need us for nutrition. When we screw things up and feed them poorly and stress over things that we shouldn't be, we're allowing for an unfavorable environment. As long as those good bacteria outweigh the bad bacteria, we're healthy. So when I see people with chronic problems, weight gain, that can't be, they've tried everything, but weight gain, depression, chronic fatigue, these kind of ill-descript symptoms that have plagued people for years, I look at the gut. That's one of the things we just have to look at. So I hope that more and more people are are looking at the gut because I'm fortunate to have a nutritionist that works with me, and she specializes in a lot of the gut issues. And I probably get 5 or 6 cases a week, and I'm a cardiologist. Can you imagine that? Okay. I'm looking at these. I hope I don't miss any. What about the new buzz subjects being taught in functional medicine? Okay, new buzz. Okay. Well, the big one, of course, is always been gut health. The other is adrenal health, because your adrenal glands are like your barometer of stress, whether it's physical stress or emotional stress. And let's face it, they generally occur hand in hand. And so when they take a beating, all these kind of things happen: weight gain, hair loss, fatigue. So it's very interesting. So we do a lot of adrenal testing. Sometimes we do neurotransmitter testing. Sometimes we do food sensitivity testing. These are the tests that we commonly do in functional medicine, are not routinely done in traditional medicine. But I think the biggest buzzwords really in the last few years, really the last 7 or 8 years, is this whole thing about gut health. I mean, I'm learning every day. I can't learn enough about it. And I have, until I did my A4M longevity fellowship, I knew nothing about it. So it's really interesting time. Okay, functional, yes. Yeah, functional versus structural. I think we mentioned that. Functional it looks normal under microscope, but it's not normal. And examples are irritable bowel disease, leaky gut. These are the kind of things that they look normal, but they certainly aren't. Okay, my chiro tells me my gut health is the key to my heart issues. Yeah, he thinks I have a leaky gut, which is causing my poor lipids. It hasn't really been established as far as that connection between leaky gut and lipids are concerned, because so many things go into abnormal lipids. One thing is genetics. One thing is definitely diet. This whole thing about low cholesterol, low fat. I think we have finally, hopefully, put that to rest. Like I said, I had success with that patient when I took them off that crazy diet and put them to the low carb. My big thing is sugar and carbs. And I think most of the issues we're seeing today is related to poor dietary choice. But as far as specifics of gut to lipids, it could be because of absorption and so forth, but I don't think that's been really worked up that well yet. Even things he can improve my Lp(a) by fixing my gut. I don't think that's possible, but I think it may be possible, but I don't think it's probable. Lp(a) is a genetic disorder in which it's a fragment of LDL. It's extremely sticky. It's extremely inflammatory. Exercise has never been shown to improve it. Diet has not been shown to improve it. The only thing that works is that we know for sure is niacin. I use a lot of it to decrease Lp(a). Fish oil can help. It's not a standalone. In women, estrogen can help. But those are the 3 things. And it really disappoints me that traditional medicine hasn't done more about Lp(a), because I tested in all cardiac patients. If I have someone young with heart disease, I'm always going to order Lp(a). And oftentimes it's increased. It's really more common. I think doctors don't order it because there's no real treatment for it. But you can lower it. There is something coming out with University of California, San Diego. They're working on a biologic. It looks very, very promising, in which they can lower Lp(a) by 70% in a matter of 5 or 6 weeks. Again, it'll probably be exorbitantly expensive, and I don't know when that will be available, but there is research being done on that now. As far as diet is concerned, I've heard everything from olive oil to, I'm all for supplements, but when it comes to Lp(a), I have never seen anything in diet that can really improve. But that said, improving your leaky gut could lead to a lot of really good things, so it should be treated. Okay, more questions. I want to make sure I didn't miss anything here. I'm just going through the list here. I'm going to make sure I didn't leave anything out. Okay, what do you personally do for your heart health? Great question. And if you read my bio, or if you'll learn more about me, my first hospitalization was actually a heart attack, a mild heart attack. Now, I have no risk factors of heart disease. I have no family history My cholesterol was like really good. I have high HDL, low LDL. I've never smoked in my life. I've always been in shape. I'm not a diabetic. But when I had my heart attack, I was under extreme stress, extreme stress. And frankly, I wasn't handling my stress well at all. I was the kind of person that, give it to me. I can take all the stress in the world. And I couldn't. So what I do differently today is I meditate every morning. I try to meditate every morning. And I do a lot of things to be in the present moment because I'm an adrenaline junkie by nature, and could obsess about anything. So that's why I like to bodybuild, and I love to dance, and I love to sing, and I love to write. Because when I'm doing these things that give me joy, I'm in the present moment. And that's very important. I even have a video that I did of that a few years ago you'll see it in my library there. So that's what I've done for myself. I devote time to doing things that bring me joy, and I meditate, and I do a few other things, but that's another topic. But that's a great question, and I work on a daily basis. My cholesterol all my typical risk factors are very well in check. So anyway, okay. Any other questions? Okay, let me see. What are hormonal relationships to heart health? A good question. Okay. Well, let's look at hormones for a second, because a lot of people, it has a bad rap because of the Women's Health Initiative in 2002 came out with the fact that, estrogen, hormones lead to heart attacks, strokes, breast cancer, and blood clots. The only thing it helps is colon cancer. But what you didn't know is that they were only dealing with Premarin, which is the estrogen derived from the urine of pregnant horses, which is anything but natural. It's synthetic. Actually, it's derived from the urine of pregnant horses. Now, the one that was synthetic was Provera, which is 5-hydroxyprogesterone acetate. Does that sound anything remotely natural to you? And they found that combination over several years really led to more heart attacks. So then hormones got a really bad rap, and then no one was taking them. Doctors took all these people off. And that's how I got into the anti-aging field, because nurses and teachers in my area came to me and said, you got to help us because the doctors here don't know from Shiola. And, they took us off hormones. So I got involved with bioidentical hormones. And then Suzanne Summers came out with her first book, The Sexy Years. And finally I said, just read her book. And so I think that's women. I think whether you're male or female, I think I'm very biased here. I'm an anti-aging doctor. I think people look better, feel better, and think more clearly on hormone replacement therapy. That said, I don't think everybody needs to be on it. With men, also got a bad rap for even as late as 2013 or 14. And I have a video I wrote about that in a blog. It was like, okay, testosterone leads to heart disease. It's not true. I can promise you that. There's these two studies that demonstrated that were deeply flawed by design. So if anything, testosterone helps the heart. It can lead to increased vasodilatation. It also can help in a lot of different ways. It also helps with insulin resistance. So I use a lot of testosterone as an anti-aging doctor and as a cardiologist. With women, actually, estrogen is a natural calcium channel blocker, so it can actually help decrease blood pressure, and certainly can help with lipids as well. So there is definitely, I think, improvements you can see with regard to cardiac health and overall health when you're on HRT, but you have to be on the right HRT. It needs to be bioidentical, and it should be provided by a physician who is well versed in anti-aging medicine and hormone replacement. Okay, that's a good question. Okay, sleep. How important is sleep? It's really important. In fact, so many things now about the the regenerative effects of sleep. And we don't get enough sleep. I don't get enough sleep. That's for a lot of us falls short. And I think, we need a minimum of 7 to 8 hours of sleep. And I think more than that is thought to be unnecessary and possibly not really healthy. So definitely 7 to 8 hours of sleep seem to be what's optimal. A great thing to get, I don't know if you've heard of it, is a thing called an Aura Ring. And it's very good sleep aid. It monitors your sleep, your deep wave sleep versus your REM, and also your heart rate variability. I haven't gotten one yet, but I'm gonna buy myself a Christmas present. That's gonna be it. But sleep is important because that's when you rebuild. Okay, like people that work out in the gym think that they're not really building in the gym. You're working out in the gym and you're breaking down muscle in the gym, but you really develop your muscle on the outside with nutrition and rest and sleep. So it's really important. What do you think of toxins generated by current fires? I think it's terrible. They've already told us that. I was just in Ashland, Oregon, visiting my eldest daughter and my grandsons, and I couldn't pick the worst time to go, right? And the entire 5 freeway from Medford to Ashland was charred on both sides with these fires. The air quality is so bad, in which this is one of the rare instances in which I would say stay inside because it was so bad. There are reports that we do now that the air pollution in itself is a risk factor for heart disease. It's not talked about much, but I'm a big person on toxins. I wrote a recent blurb on bisphenol B, which I think is really important. Bisphenol A, I'm sorry, which is in the plastic industry, how it's screwing up our environment, and it leads to metabolic syndrome and it's a hormonal disruptor. So I think toxins are a really big thing now. And I think the fires for sure. There are already reports on that. It also makes you more prone to develop complications from COVID-19. These fires are not a good thing. Okay, let me see, did I leave something out here? Thoughts on permetrium. Permetrium is a natural form of progesterone, and it's derived from peanut oil. It's in a peanut oil, and it's good. Nothing wrong with it. The problem with it is that it only is in 2 doses, 100 milligrams and 200 milligrams. So as an anti-aging doctor, I often I devise my own doses, 125, 150, 175. I don't use 100 or 200. So with a compounding pharmacy, you can kind of derive what you think is the best dose for the individual patient. And some people are allergic to peanuts, so that's very important. But it is a natural progesterone, and I think it's fine. And I think insurance probably covers it, whereas they don't usually cover the standard, the bioidenticals. Okay, the recent publications indicate post-COVID infection cause heart issues. Can you elaborate? Also, recent clinical trials indicate melatonin is antioxidant can risk. Okay, I'm not familiar so much with yes, melatonin is a wonderful antioxidant. It's not just a sleep hormone. It is a strong antioxidant. It also has some anti-cancer qualities. So a lot of people in the integrative cancer field use high dose of melatonin, as much as 20 milligrams, which is a big dose. I don't know the association between that and the risk of COVID-19. However, I will tell you that I've been very vocal on social media since the beginning of this pandemic, because everything is about washing your hands, social distancing, wearing a mask. Of course, we do that, right? That's what you need to do. But that really only stops the transmission of the virus. We're not stopping it. We're not cutting it short. We aren't getting rid of it. So you have to look at lifestyle. And I've had too many patients come in and see me that I've gained 5 pounds, I've gained 10 pounds, I've gained 20 pounds with this pandemic. And that's why I've been very vocal from the very beginning and say, this is not the time to imbibe on comfort food, which is basically carbs and sugar. Because why? Because see, sugar will compete with vitamin C for your immune cells. And we don't want sugar to win the battle. So I have been very, very vocal about that. And I even came up with my own supplement called 𝘃𝘀𝗧𝗿, because it has 1,500 milligrams of vitamin C, and it's got 25 milligrams of zinc, and it's got 5,000 milligrams of D3. And I think it's very comical and amusing almost that Dr. Fauci, who I respect greatly, just finally came out and said, oh, I take high doses of vitamin D3 and vitamin C. It's like, why did that take so long for that to get disseminated? But it just came out last week. It's like, and oddly enough, it came right after a major study that just looked at the benefits of vitamin D3 in reducing COVID-19. So I like to think that some of us in functional medicine were ahead of the game, saw this coming, and why we're so vocal about taking your appropriate supplements and your diet and lifestyle. Because, see, as Americans, we're looking at the magic pill, the magic bullet, the magic vaccine. But I'm here to tell you that it doesn't exist, and it never will exist, because you have to have an attack immune system. So when you get a vaccine, you're getting an attenuated form of the virus. You have to be healthy enough to be able to form an immune response to it, antibodies, okay? So that's why 50% of people with get a flu vaccine, it doesn't help. It can actually make things worse. So I'm very big on lifestyle, vitamin C, vitamin D, and I think some of these, I have to read more about the melatonin. I haven't gotten up to that one yet, but there's so many things we can and should be doing. Yeah, 1 to 3 milligrams of melatonin is sufficient. That's what I use in my sleep formula. I know for cancer they use much bigger doses, but I have to read more about that for the COVID-19. Vitamin C, D, zinc. Also, I have an RN that works in my office twice a week, and I just got my IV today. And we do a lot of IV therapy with high dose vitamin C, meaning you can't get that high dose by taking it orally, or you'll be on the toilet all night long. So IV therapy is not a good way to go, but you can really, I just supplement on my IV therapy with my own oral therapy. And these are important things. We need to maintain a certain amount of health if we want to combat this virus. It's not just about, we can't social distance forever. We can't be wearing masks the rest of our life. I mean, right now, what we're doing, folks, I'm sure you'll agree, is we're subsisting. I don't really call this living, but you do it because we have to do it, because we want to reduce the transmission of the disease, but we aren't stopping it. Okay, let's see what else. Berkeley. Okay, so yeah, we're going to be getting into 𝗃𝘀. Okay, so in my formula, okay, I have the vitamin C, D3, zinc, quercetin, which has been shown in some of the studies of COVID-19. It's a natural anti-inflammatory agent. And also I have NAC. NAC is N-acetylcysteine, which is a precursor to glutathione, which is the strongest antioxidant that your body can make. So again, it's just being proactive, using supplements, using diet, using exercise to make yourself as healthy as possible. Because we're the ones, hopefully, that won't catch this virus. If we do, we'll have a very minimal response to it. So that's my take-home message. Okay, another question from Nicholas. Why hasn't off-label usage of estrogen blockers, such as tamoxifen and anastrozole, made it into mainstream medicine? Okay, interesting. So what he's talking about, we do, this is really reserved, I guess, for people that treat a lot of hormones. A lot of gynecologists are not really integrative or into functional medicine. Some are, but I would say in my area, no one is. That's why I have so many women patients. But if you look at estrogen blockers, like when I test a female, after she's been on HRT for a while, I'll test the urine because blood is not that effective. So when I test the urine, they'll tell me how they metabolize their hormones, and if they're estrogen dominant, or if they metabolize it in an unhealthy way, that could potentially lead to cancer. And then I would use an estrogen blocker, or I would reduce the dose, or have them take supplements that will help them go from an unhealthy pathway to a healthy pathway. It's part of my training. I did not learn it in traditional medicine. I learned it in my anti-aging medicine therapy, and they did the same in functional medicine. Why off-label use? I mean, I use a lot of off-label stuff. I use HCG and Clomid, which are fertility drugs in women. I use it for men that have enough testosterone, but not enough. In other words, it's not low enough to put them on testosterone therapy, but it's not getting to the level that we would like them to. So I can often do a combination of HCG and Clomid, and I will sometimes double the production of testosterone in a male, and they feel great. And I'm just doing it naturally. I'm just making their own body put out more of the testosterone as opposed to giving them testosterone. So those are off-label uses, and as long as it's safe, and that's the important thing, I think it's a great option to give. But I don't know if it ever make it mainstream. I mean, it's just that's the difference, that we have to deal with. let's see. Did I get everything? Alice is so helpful. Vitamin D, IBC, zinc, melatonin. Yes, we use all those things. But we will go over supplements. I have a whole list of topics kind of that I've figured out. This is kind of to introduce everybody. Okay, good. Another question from Alice. Alice is on top of things. Coronavirus 2 attached to ACE receptors. ACE receptor plates. Okay. And when this first came out, there was so ACE receptors are receptors on lung cells and other cells in the body that can actually that the virus can attach to. So the feeling is that, oh my God, then what's going to happen is that the virus is going to spin out of control. And so what's the big deal? Because a lot of patients that I treat are on ACE inhibitors or angiotensin receptor blockers, which goes that same pathway. But it's been found, thank goodness, that actually patients on these drugs do well. So, but when this first came out, like in April, whenever the pandemic started happening here in the United States, it was like, oh my God, we got to take everybody off ACE inhibitors and ARBs. And fortunately, I said, I don't think so. I don't think that's a good idea. And the evidence came out over the next 6 weeks that it's not a good idea. It does not increase the chance for the virus to spin out of control. So we don't do it. Okay. Angela, recent study suggests that up to 35% of post-COVID patients are asymptomatic. My great question. Thank you so much for asking that. Okay. Now, I want you to know that mild cases of COVID-19 are basically anything that doesn't hit the hospital. So if you're not hospitalized, you have a mild case. And that's a broad spectrum, right? If you admit to the hospital, you already are classified as high risk. Now, once you admit to the hospital, about up to 30% of patients will have elevated cardiac enzymes, which means there's cardiac involvement. And it doesn't mean they're having a heart attack. It generally means they're having what's called myocarditis or inflammation of the heart muscle, which we know COVID-19 can do. And that in itself portends a worse prognosis. Once you are in the hospital and you do have elevated cardiac enzymes, the prognosis is worse. So we treat it like we treat any inflammatory disorder of the heart. You know, we don't have to do angiograms, but usually we have to support them with various medications. This is when you need to do traditional medicine because they're sick. And we can often pull them through. But once you have myocarditis and you have elevated cardiac enzymes, more specifically troponin, it does worsen the prognosis. And she's right, about 35% of patients that hit the hospital will have elevated troponins. What to protect ourselves? Thank you. Just what we're talking about, you know, it's lifestyle. It always hinges on lifestyle. I said that now, I've said it before, and I'll say it as long as I can breathe because it's so important. Now, another question is, can taurine help with myocarditis? I don't know the answer to that question. Taurine is an amino acid, so it's something that's natural. It is useful with certain arrhythmias, but I wouldn't use it in place of the standard medications because once you have myocarditis and the patient really is in heart failure, you got to go for the guns. You got to go for beta blockers, ACE inhibitors, ARBs, diuretics, nitrate. There's a list of medications that treat heart failure and do it quite well. So that's an emergency. So can taurine help? Possibly. I just haven't seen anything really in the literature to support it, but it may be. So I'll have to try to research that for you. But again, once you hit the hospital with heart failure with COVID-19, it's a serious issue. Now, also, I want you to know that these mild cases, you know, the ones that never hit the hospital, aren't really so mild because I've done reviews on this. People, it was a study from the Atlantic published this, and I wrote a blurb on it on Instagram. Is that it was a British in England, British subjects, several of them that had mild cases. We're talking weeks to like 3 or 4 months later, they still have shortness of breath. They still have brain fog. They're having problems concentrating. They can't go back to work because they just don't feel normal. So this is the scary part about COVID-19. You could have a mild case, but yet not really be functional. And this is a British study, but I think we've also replicated that here in the United States. That a lot of people, they have residual effects. I've had several patients. I'm very fortunate in my practice. So many of my patients have had mild cases and gone to be, you know, pretty good, pretty normal. But I've had a few that took 3 or 4 months. With mostly fatigue is the main thing. Okay. I think that's, God, we went over 49 minutes. Woo, 50 minutes. I'm really impressed. So, does your office carry grounding supply? Oh, good question. My thoughts for COVID-19. Because grounding, anybody heard about earthing? Angela and I were involved with a study on earthing a few years ago with Dr. Sinatra, which we were using walking barefoot in the sand or in soil or being grounded with mats at home and sheets. And it decreases inflammation, does it quite nicely. I think it's extremely useful. I haven't seen much information on it, but I am in contact with Clint Ober from the Earthing Institute. And it's felt, since we know that grounding and earthing do help lower inflammation, that there's definitely a role in COVID-19. Because one thing is the initial viral infection itself, and the other is when inflammation takes over and we have what's called a cytokine storm, which inflammation does spin out of control. So yes, I think earthing is useful for almost anything. So I'm a big fan. And we can get you grounding supplies. We're involved with a study which we actually gave it out, but we are involved with it. So the Earthing Institute has everything that you really would need. So listen, I think that's about, I don't want to, but this has been great. The questions have been super. So we're going to be meeting in 2 weeks. And the next topic is going to be, what is the difference? We talked today was functional medicine. Now we're going to be talking about, we're going to hone in on what I do as an integrative cardiologist, to be a little more specific to my specialty. And if you know anyone who didn't get a chance to see this, this will be on my YouTube channel probably within the next 24 hours. So you can go back to that. And just my last ending is that the information given here is, of course, information. It's not meant to diagnose or treat a specific problem. You have to go to your primary care doctor for that. But so that's kind of the typical disclaimer we have to give. But I'm here to answer questions. I love you guys. You're a wonderful audience. I am eternally grateful for your presence and your interest. And thank you. So we'll see you in 2 weeks, okay? And we'll send out information about it. Bye for now. Have a great evening, everybody. Thanks.